Now for the next issue in the heart in children, which we'll be looking at, is tricuspid atresia. Tricuspid atresia in children. Do you understand? Like, what could be the effects of this? Okay. So tricuspid atresia. Now, one thing you should actually notice here is the right ventricle that is usually long up to this place. It's not developing fully. So a bulk of it is muscle. The space in it, which is the right ventricle, is not much. Do you understand? Me, that's what I could just notice from this picture. But we'll discuss it, you get to see it. Now you can see an infant affected by this, and you can see a whole lot of distress. Okay, so it's just a rare, but it's a serious congenital heart defect. Usually affects newborns. Occurs when the tricuspid valve, which normally connects the right atrium to the left atrium, right atrium to the right atrium, fails to develop. As a result, blood cannot flow properly through the right side of the heart, leading to underdevelopment of the right ventricle. Because from our knowledge of anatomy, for a part of body to develop fully, it must have been functioning fully. Okay, that's the law of disuse. So you have not been using the right side of the heart to the extent that it's kind of like going off, right? So you can see that there's a closed valve here. Okay, there's a closed valve there, So in a normal heart, oxygen poor blood, that's deoxygenated blood, should flow from the right atrium down to the right ventricle through this tricuspid valve. But if the tricuspid valve is developing poorly or is totally closed, okay, you have an issue like that. So tricuspid valve is missing, so blood cannot enter the right ventricle. So the right ventricle, because you have not been using it, law of disuse, is kind of like going off. So blood must pass through an atrial septal defect into the left atrium. So you have a mixture of blood here and there, okay, which is not supposed to be. Okay, so symptoms in infant: the baby is not having sufficient oxygen delivery to cells, so the skin is bluish. They have breathing difficulties. Is weak, poor weight gain, heart murmurs, lethargy, irritability. Okay. See all these issues. Alright, so diagnosis is prenatal ultrasound, postnatal echocardiography, pulse oximetry, chest x-rays, and ECGs. Okay, so you see this, kind of like closure, So treatment options: prostaglandin therapies to keep the ductus arteriosus open. Alright, so that there is at least an exchange of oxygenated blood, okay, and deoxygenated blood. Okay, so shunt surgery: a temporal shunt may be placed to improve blood flow to the lungs. Right, Glenn procedures to connect the superior vena cava directly to the pulmonary artery bypassing the heart. Okay, Fontan procedure is usually done at the age 2 to 4. The Glenn procedure, they do it 4 to 6 months. Okay, so it connects the inferior vena cava to the pulmonary artery, completing the rerouting of blood to the lungs without passing through the right ventricle. Okay, so that's just it for what tricuspid atresia simply is.